All right, so we are back. This is Senate Health and Welfare. We have completed our work on 238 and passed it to the full Senate, and now we are turning our attention to H91. And let me just say up front, I have received late. I don't look at my email because I don't have time. But late last night, I did receive some emails from different folks asking for language. We are not at that. With apologies, there's no way we can incorporate all the language changes we've been asking for. Oh, it's a work in progress. We'll go back to the House. There'll be an opportunity for whatever conferencing or further proposals. So I'm hoping that we can get to some closure on most or all of the bill this morning and then come back tomorrow for the final vote. I think that's the best way to approach this. And I do know that the administration had sent some language request changes, and looking at that, some of the changes they were asking for were changes that they had put in the first place. So I'm trying to sort out where we are. We'll go through and see what's what. So, Hayden, thank you for your work.
You're welcome.
Then we have a new draft.
We do. 4.1.
All right, so why don't we go through 4.1? Would anyone like a hard copy? Side me. Got it. Okay, so good. Okay.
Okay. Can you get that up?
It should be on your desk. He's always ahead of us.
Should I just go through the changes on this round and then if you want to do a deep dive?
Yeah, let's do that. Let's go through changes and then deep dive.
Okay, so same sort of highlighting to mention as we were looking at before that the newest language is in green. So in our legislative intent section, page 4.
Oh, there's one on page. Oh, that's the yellow.
That's yellow.
Okay.
That's old new language.
All new language. Okay.
Subdivision 7. You added the language about reducing reliance on use of hotels and motels, and yesterday you added reliance on the inefficient use of hotel and motel rooms. In the purpose section, I corrected a typo. Instead of these programs, this program on line 3. In subdivision 2, again, the same language, reducing reliance on hotel and motel rooms, and you've added the language inefficient use. And you've added a third item to the purpose section, which is to assist in maintaining housing for households at risk of homelessness and transition households experiencing homelessness to permanent housing. So that's one of the purposes of the art. Definition section, we don't have any new changes. Regional advisory councils. Each community action agency shall convene a regional advisory council whose membership reflects, to the extent possible, the growing diversity among Vermonters.
I do have one question that comes up as you're thinking through the caps. This is a very late question. It's not something we can deal with, or perhaps we can. But each of the caps has a governing board, what I understand. And we have said nothing about the governance structure for caps. Whether we should or should not is an open question. So let's leave it at that, because sometimes governance boards are highly effective, and sometimes they're less engaged. Lily,
their structure is in federal law.
huh?
The structure is in federal law. Those that used to be.
So, but the question is, are all of the governance boards currently effective in their work? And I'm looking at Lily, and it's a hard question to answer. If you just say some are better than others, or
Thank you. Good morning. Lily Sojourner, Director of the Office of Economic Opportunity for the Department for Children and Families. So to the Senator's point, there are strict board of director requirements for the community action agencies. they have, brief overview, public sector requirements for, participation in private sector, and then, either Vermonters experiencing low incomes or people who represent that sector are required to participate on the board. So it's a, very prescriptive board, balance that's required. And then we monitor their board roster quarterly. They have an annual requirement regarding the board. Part of their annual organizational standards review requires a number of pieces for board governance. It is then challenging to ask the question of, does that always maybe translate to effectiveness or not, right? But there is a very robust system around that, and that could potentially in the future be built on, or we could share more about that, but that is currently in place.
No, that's helpful, and it is federally mandated. That's the point of. Okay. So
The
I
structure,
know that
yeah.
the issue was raised to me by someone else about you don't have anything in there about governance structure, and it's already in federal law. Okay. All right.
Okay. Continue on. We're in the portion of the bill that takes effect July 1, 2026. Establishment of VHARD. There was a request to change this. Subdivision 1 pertains to the network, and the department, the previous language said the department shall select and contract with, and the request was made from the network and the department to be shall select and enter into an agreement with instead of contract.
Excuse me.
In 2205, authorization process, reauthorization review. When we spoke yesterday, we spoke about ensuring that this section wasn't just about the caps, but that it was also had a selection process and language specific to the network. So that is what you're seeing in subsection A, that the department shall select and enter into an agreement with a statewide organization to provide or cause to be provided supportive services and shelter to those households that are experiencing or that have experienced domestic or sexual violence. The department shall conduct regular reviews of the statewide organization to ensure compliance with this chapter. The statewide organization may be subject to corrective actions by the department if, within the constraints of appropriated resources, it no longer meets the requirements of this chapter or has failed to adequately meet the needs of households that are experiencing or that have experienced domestic or sexual violence. If the statewide organization cannot fulfill its responsibilities under this chapter, the department shall work with another entity to ensure that there is not a gap in services. So you can hear that that is parallel or mirrored from the language we already had in place on with regard to caps, which had been A, and now we're relettering it to be subsection B. And this is the same language, it's just being relettered. You're now referring to the capacity to perform core services, not just services required in 2206, because that title, that heading, section heading had changed. There is a new item in subdivision D, the capacity to seek and accept charitable contributions, grants, and services of volunteers, including money, clothing, and furniture. That is one of the requirements to be authorized as a community action agency. I mean, a community action agency operating under VHARD. Subdivision 3, I'm updating a cross-reference because we have reorganized this section. And then I've sort of reorganized the order of the sentence tree. The department may review progress of any previously required corrective actions and may review community action agency performance between reauthorization reviews. So same substance just in a different order. VHARD for services, changing D to housing, navigation, and retention services. And then there are a number of items on this list that have been combined into subdivision G. Navigation to other services and supports as identified in the household's housing plan including economic benefits, peer-supported services, job training and employment services, services related to disability and independent living, and referral to healthcare systems such as treatment for mental health conditions and substance use disorder as provided by the designated and specialized service agencies and preferred providers, respectively. Correcting a typo on line 11, subdivision 3. Now we're in the section on use of hotels and motel rooms. And subdivision D, there's an item that we wanted to break out as a third category. So this now reads, a hotel or motel is being utilized at community action agency. Shall in number 1, shall in number 2, and in number 3 may use strategic placements to the extent certain populations are not isolated from the wider community being served program.
We skipped over motel and hotel room because it's yellow, so we'll come back, when we come back, remind me that I'll remind myself. Okay.
Duties of the department. The department and the agency shall have the statewide responsibility for meeting the intent of the chapter, including statewide planning, system development, proposing adequate funding, and the involvement of all the agency's departments. Where mutual planning needs, I don't think there are any changes there. Reporting requirements. This is the report that comes in every 3rd month. There were a number of changes. The department provided some recommendations, some of which are reflected here and some of which are not. So in subdivision 1, the number of households served through the program by household size and, if applicable, by eligibility category, region, service provider, and type of service. Subdivision 2, the number of household members employed on a part-time and full-time basis, and the number of household members receiving supplemental security income or SSDI.
Okay.
3, changes in capacity for shelter beds, nursing homes, and residential care homes since the previous reporting period. And then the other items were already items that were previously listed. Regional advisory councils, this is the same language to the extent possible, just so it tracks in both places that regional advisory councils are being discussed. BHART implementation planning. This is the true reports, October and January. In the October report, in subdivision B, recommended intake assessment and processes to determine appropriate shelter and services for households based on program eligibility. And a recommended process to enable an unwilling community action agency to opt out of participation in the program in a manner that gives the state adequate notice. That's something the committee talked about adding a day or two ago. And then we don't have any changes to our January DCF report. Section 7 is the interim needs assessment and the final needs assessment coming from the community action agencies and network prior to BHART taking effect. So some language here has been changed. Says on or before January 15, the community action agencies shall submit one comprehensive report, and the statewide organizations shall submit a separate report to the various committees, including estimated fiscal year 2027 budget proposals, estimated costs of administering the program, and analysis of any barriers to generating additional shelter and permanent housing in the region. On or before April 1st, the statewide organization shall submit a report and the community action agencies shall submit a separate comprehensive report detailing the results of each region's needs assessment and implementation plans, which shall not exceed the budgetary proposals provided in the January 15, 2026 progress report. 2. Various committees. Appropriations, page 31. Change in the first appropriation, reducing that 5.985 to be 4. And then under the appropriation for Bridges to Health, 515 to Department of Health for distribution of Bridges to Health for services to individuals who are experiencing homelessness or at risk of becoming homeless. And then that 1 million that we took out of subdivision 1 is being added here, 1 million to DCF for the distribution of grants to municipalities, planning and implementing services for households that are at risk of homelessness or experiencing homelessness in collaboration with the community action agency serving a municipality's region. And then with regard to the 3 million, 3 million to DCF for the Vermont housing for distribution too.
Distribution.
For distribution to the Vermont Housing Conservation Board to provide support and enhance capacity for the creation and expansion of emergency shelters and permanent supportive housing capacity in consultation with the department to ensure new investments are paired with appropriate support services. Legislative intent has not changed. Transition language has not changed. Effective dates, a new subdivision 3. So now we'll read this. Act shall take effect on July 1, 2025, except that. Skipping down to 3, the Department for Children and Families shall commence the rulemaking process prior to July 1, 2026, in order to have rules in place on that date.
One of the sticking points, I think, is going to be the amount of money that we currently have both in the budget at the 36 million level for the GA program. And then also this $10 million. And I'm hearing from the administration that is an issue. So I think everyone knows that. We ought to be aware of that. We worked hard, I think, to use the $10 million appropriately in this bill, because the appropriations placed it in the bill for us to define and the conference committee did that together, as well as the conference committee agreed with the governor's proposal for the GA money that's there. And what we have done from the beginning is to focus on the new program and how it is implemented and the timeline for that implementation. We have not looked at making changes to the GA program, although we know GA program will ultimately be engulfed. Not even program, the GA, whatever, will be part of this system. So I've actually talked with the administration about, well, how can we reduce the money here? It's based on what the needs are out there. We don't know what the needs are right now. We don't know what's coming in the fall or the winter for emergency housing. We do know some of the needs for more permanent housing, and this bill is going to help us move in the right direction to reduce dependence on hotels and motels. I also asked for, and I've been thinking about how can we have some of the GA money flow earlier than what we have here? How can we have our regional CAS involved in the decision making about that, so we can begin to change the process that many see as difficult. So that's a concern of mine. I'm just sharing you some thoughts that, and some of the communication that I've been having with, the administration on this. If you look, we have the budget from the, CAPS. We think that that works for them and the work that they have to do. We've added in the, healthcare piece to help folks who are homeless, to include Bridges to Help. And we've added in some, grant possibility for municipalities that we continue to hear from. Vermont Mayor's Coalition sent a letter last night. We're in the process of replying for them. They're very concerned about the burden that's placed on public infrastructure and, services when they have shelters in their, towns. It's a legitimate concern, no question about it. It's added, with folks who need special, attention. And then we have, the Department of Children and Families certainly needs some resources to complete the work for this. And then we have the $3 million for the shelter. So, shelter program, and I know there's shelter money in the big bill as well. But here's, what do we do if we took $3 million out to reduce the amount in this bill? What good will that do? But that's kind of the question that I have there. So the $10 million that's in the bill, I think, makes sense for the work that we've done. If there were something we could do to reduce the expenditures overall, that would be awesome. But, so just, I'll stop. So I think questions for Katie on the changes, and then we'll go through the entire bill together, do that. Makes sense. And
I mean, I won't support the bill if we're gonna underfund it, because we would doom ourselves to failure.
Thank you.
And I feel the same, you know, I'm in finance and it's the same with the education system. I will not support something that's out of the gate is underfunded. So, it's a. Right, it's a non-negotiable, so I'm hoping that we can stick with what we have and not take it.
I think we've done a good job on the appropriations. And I don't think we've left thinking out. I don't think we've left issues out. And I haven't heard anyone say we don't need that $3 million for shelter work. And I was approached by DHCD yesterday saying, well, please keep it in.
It's for infrastructure.
Yeah, yeah, it's very.
I think that's important. I think the administration thinks infrastructure is important for this.
Yeah, I hope so. I know. I think the concern is that the GA isn't now being subsumed in this automatically. I don't know how they can do that right away. Lily, you have your hand up.
Yeah, thank you. Just regarding the $3 million, that now would be flow through BHCB, which is, a process that we've used in the past, and they absolutely have the expertise. I do, want to raise the potential for when we think about permanent supportive housing, there's both the infrastructure, which then would flow through BHCB appropriately, but there's also the supportive services. And then I think we've also found it really efficient to have rental assistance, and that can be a really cost-effective tool. So, you know, for the committee's decision, if you're really looking for it all to be bricks and mortar, then I do think that full $3 million to go to BHCB makes sense. If you wanted to have a little more flexibility so that some of it could be bricks and mortar and some of it could be either for the supportive services or the rental assistance, I think can be an important part. And we've seen that with programs like VHIP in communities where they've been able to pair that with rental assistance. I think in the Northeast Kingdom, they've done that really well. So I don't know if you want to build in any flexibility there.
So we have the language there that is in the last line, so, well, two lines, in consultation with the department to ensure new investments are paired with appropriate support services. Does that accomplish what you're?
No.
No, it doesn't, because it just says.
It's saying that the money goes to VHTV.
I
I know
know,
what Lily's saying was maybe you should do something prescriptive. So that it can be used for that, right?
It could be a little flexible.
More fun.
I just wanted to raise that, right, ultimately, it's
well,
your
no, but what
choice,
would-
yeah.
so you're suggesting it would go to, DCF or AHS and then distributed to VHCB?
I think perhaps, again, if this is the committee's preference, $3 million to the Department for Children and Families for the Vermont Housing and Conservation Board,
Or,
and or other appropriate agencies to provide support and
okay, so you're thinking transportation? You're thinking of all the global,
more specific, I think that, you know, when we think about what it takes usually for folks to be successful in housing, right? It's the unit, it's the services associated with that unit or rental assistance for the unit. Services we wouldn't necessarily go to for one-time funding, but potentially some of the rental
ongoing operating
assistance,
costs.
that would go, you know, to the participant's landlord. It's just an option to build in a little bit more flexibility there. And again, the committee may decide that the 3 million should just
Okay.
go to the bricks and mortar.
Okay, so the Senator, Cummings and then Senator
We're
Brewer.
gonna get wide variety of people with a wide variety of social skills. Example, I have something that has apartments in downtown. Some stay place people are one from the apartments. I had no idea we take out a street. And you'd have a disposal of trash and garbage and things that come to the community. Once somebody said, look, you need to do this, and this is where you take it, and how to do it. There was no problem. But it's sometimes just something that basic, this person was slightly mentally challenged, but, you know, especially you're not looking at individual detached homes, you're generally looking at apartments. And just the social skills. So living there,
Yeah,
yes, the supportive services. Adds flexibility going, yes, would be, I think, a good thing.
what would we add here? I'm fine with that. I'm glad to have these. How would you, or that, either Katie or Lily or both?
I'm looking at it right now. Can I email you?
Well,
Yes, and
okay, we're
or,
right here. I'll tell you what we'll do. We're gonna go through the bill.
Okay, thank you.
And hopefully we'll get to this place again.
I appreciate that.
Yeah, let's do that. Nolan, do you want to comment on this?
No, I had a comment on something else.
Okay, go ahead.
That's also appropriate.
Good.
I was wondering, we want to be, maybe you've had this discussion, right, there's a reason, but the 4.9, it says to DCF for distributions, the community actions and the statewide organization, it's all molded in there, but we know that 400 goes to the network.
Yes.
That might not be clear, and the
We can
administration,
sort that out.
might only give them 100.
Okay.
Like, so you might want to be.
Put that on another line. Yeah,
That's
a good suggestion. We don't all lose that thought. Thank you. We know that, right?
We know that,
We'll probably talk.
not clear
Right.
from the legislation.
Clearly, right. Okay, so why don't we go through the bill and we'll go through the finding. And then the bill is organized by date. Once we get there.
The codified portion.
Codified, so the session law is. No, okay, so maybe help us understand the date.
Sure. And I have a chart I put together at one point.
We do, we have that chart. Kiki, can you throw that chart back up on our webpage? That'd be helpful. Yeah. The timeline.
Well, Katie did a chart and Katie did a timeline, but maybe the.
Yeah.
Amy's time.
Please.
Start with findings. The General Assembly finds that according to the U.S. Department of Housing and Urban Development's 2024 Annual Housing Assessment Report, Vermont had the fourth highest rate of homelessness in 2024, and that 53 of every 10,000 Vermonters are experiencing homelessness, with only Hawaii, New York, and Oregon experiencing higher rates. In 2023, according to the same annual homelessness assessment report, 51 of every 10,000 Vermonters are experiencing homelessness. According to the Vermont 2024 point in time count, there were approximately 3,458 unhoused individuals in Vermont, which represents a 300% increase over the 1,110 unhoused individuals prior to the COVID-19 pandemic in 2020. Top of page 2. Of the 3,458 unhoused individuals in Vermont identified by the Vermont 2024 point in time count, 166 experienced unsheltered homelessness, which is the highest count of unsheltered homeless individuals in Vermont in the past year. According to the Vermont 2024 point in time count, over 35% of those Vermonters experiencing homelessness were unhoused for more than 1 year, and over 72% were unhoused for more than 9 months. According to the Vermont 2024 point in time count, 373 of those Vermonters experiencing homelessness were children and youth under 18 years of age, and 646 were 55 years of age or older. According to the Vermont 2024 point in time count, Black Vermonters are 5.6 times more likely to be unhoused as compared to white. The 2024 Vermont Housing Needs Assessment notes that 36,000 primary homes are needed in Vermont between 2025 and 2029, 3,295 of which are needed to address homelessness. Did I misstate something?
Oh, sorry, I'm just reacting to those numbers.
I wouldn't put it past myself to read the number there. Subdivision 9, the 2024 Vermont Housing Needs Assessment notes that half of all Vermont renters are cost burdened, and 1 in 4 pay more than 50% of their income on housing costs, putting them at high risk of eviction, which is heightened by Vermont's rental vacancy rate of 3%, which is well below the 5% rate of a healthy market.
So my question is, there's nothing in here about the number of homes or shelters that are affordable. Nothing in here about affordable housing or shelters that have been built since 2022, 25. Nothing in here that demonstrates.
There's not. Adding a finding would require having the documentation to support it.
Okay, well, maybe we can try and find.
Yeah, Frank Knack with Housing and Homelessness Alliance. DHCD has done a number of presentations this cycle where they know the number of affordable homes that have been built between 2020 and 2024. And so I could pull that. So
Can you pull that for us? I think it would be important to have that finding, because this is all about what we don't have, but then it will demonstrate that we're trying to make progress to have.
Can you, when you send it, direct me to the exact site for the, yeah.
Thank you. That's good. I knew that. Yes. Okay, and I've seen that.
Section 2, legislative intent. It is the intent of the General Assembly that unsheltered homelessness be eliminated and that homelessness in Vermont be rare, brief, and not reoccurring. It is the intent of the General Assembly that BHARD is a step towards ensuring that homelessness be reduced in Vermont and interim shelter opportunities be available to provide a stable pathway to permanent housing for all Vermonters experiencing homelessness, including safe shelter options for individuals living in unsheltered homelessness. That Vermont increase the supply of emergency shelter as well as permanent supportive housing that meets the specific needs of individuals. That community components of all shelter types are integrated in a systemic manner. That time limits night by night shelter, relocation between interim shelter sites and other disruptions and housing stability be eliminated to the extent possible. That Vermont's emergency housing statutes, rules, policies, and procedures and practices be modeled on housing first principles where appropriate. That non-congregate shelter be used to the extent possible. And that Vermont reduce reliance on the inefficient use of hotel and motel rooms to shelter participating households and expand the use of emergency shelters throughout the state for this purpose.
Are there any? So how about providing shelters and shelter services? And do we want to say anything about coordination between and among organizations, between and among with municipalities? You want to say anything about that here?
Could modify 3 community components
Yeah.
of all shelter types are integrated in a systemic manner. Could say something broader about shelter and supportive services provided by community providers are integrated in a systemic manner.
Well, it is there, that, I mean, that's it, but then. I guess that works. Community components is pretty broad.
Okay.
Yeah. I'll make sure that we have it.
Subdivision subsection C, it's the intent of the General Assembly that BHART for places of provision of emergency housing through the GA program beginning in fiscal year 27 and the HOP program beginning fiscal year 28. And then we move into the language that's being codified, first the language in July 1, 2025.
So all of that is codified, and now we begin with
What will be in the
what will be in statute.
So you're setting up a new chapter. The short title that we cited as VHART, the VHART program. Purpose, the purpose of the General Assembly to replace the provision of emergency housing through the General Assistance Program of this title and use funds and resources previously attributed to this program and any other identified state and federal monies to VHART established in this chapter. Purpose to reduce reliance on the inefficient use of hotel and motel rooms to shelter participating households and expand the use of emergency shelters throughout the state for this purpose, and assist in maintaining housing for households at risk of homelessness and transition households experiencing homelessness to permanent housing.
You could, yeah.
Going, okay. Definitions as used in this chapter. At risk of homelessness means precariously housed without sufficient income, resources, or support to prevent homelessness. Community Action Agency means a designated agency pursuant to 3 VSA chapter 59. Community.
So this is important for us to understand and how they are being treated as a designated statute.
The same concept, but we might want to avoid using designated agency because it will
I know,
create confusion. They're
Yeah.
authorized and
they're
authorized
authorized
entity.
to do this
Mhm.
as a designated organization. Okay,
Subdivision 3, community-based shelter means a shelter that meets the department's standards for the operation of shelters. Department means DCF. Extreme weather event means extreme hot or cold temperatures or weather events such as hurricanes, flooding, or blizzards. They create hazardous conditions for outdoor habitation by humans. Homeless means lacking a fixed, regular, and adequate nighttime residence, facing imminent loss of primary nighttime residence, fleeing or attempting to flee domestic violence or otherwise defined as homeless under federal law. Household means an individual with any dependent for whom the individual is legally responsible for domicile in Vermont as evidenced by an intent to dwell in Vermont and to return to Vermont if temporarily absent, coupled with an act or acts consistent with that intent. Household includes individuals who reside together as one economic unit, including those who are married, parties to a civil union, or unmarried. Unsheltered homelessness means sleeping in a location not designed for or ordinarily used as a regular sleeping accommodation. Regional advisory councils. Each community action agency shall convene a regional advisory council whose membership reflects, to the extent possible, the growing diversity among Vermonters, including individuals who are Black, Indigenous, and persons of color, as well as with regards to socioeconomic status, geographic location, gender, sexual identity, and disability status. Members of an advisory council shall include organizations providing services in the region, the department and representatives of the agency, and each department of the agency as needed. A regional advisory council may collaborate with individuals with lived experience of homelessness, community partners, state partners, housing providers, local housing coalitions, statewide homelessness organizations, providers of coordinated entry, continuums of care, faith-based organizations, and municipalities in the region served by the Community Action Agency. Subsection B, each regional advisory council shall provide advice and recommendations to the Community Action Agency and its region regarding the design and implementation of the program. The work of each regional advisory council shall be informed by regional planning commissions, housing targets. Each regional advisory council shall meet on at least a quarterly basis. The regional advisory council shall have the legal and technical support of the department. So that's everything that takes effect July 1, 2025. And then we move into what takes.
Okay, so any report that comes back, then we've got reports coming back from this process that are gonna be October, January.
So that would give you an opportunity to amend what we're about to read. The language that takes effect July 1, 2026 before it becomes effective.
So we'll get all of this information back and then beginning January next year, we'll be able to evaluate what, if anything, needs change. Lily has her hand up.
Thank you. I mean, I do just want to share or raise at this point why we are talking about state fiscal year 26, just what I think the commissioner shared yesterday that, the administration does have some questions and concerns about the budget or about GA going into state fiscal year 26. And if there are anything.
Can you
That
speak
could
just
be-
a little
oh.
louder? I got that machine over there.
Yes, that's
Bugging
everything.
me.
Thank you.
So the DCF has concern. The
Yes, so-
administration has concerns.
So just while we're in, as
Yeah.
legislative council said, talking about state fiscal year 26, just wanted to raise again what the commissioner shared yesterday about the interest in the administration to see if there are any ways to incorporate some changes to the GA program in this bill for state fiscal year 26. Just wanted to raise that if the committee was interested or not, and again, just at least reiterate what the commissioner had shared yesterday.
So I'm equally concerned about that. It would be great if there were a way in 26 to begin. I think that's going to be an ongoing discussion unless we have some miracle language coming in that allows for that merge to occur. It's going to end up being a BAA or a merge, a BAA, or possibly a budget discussion. I'm very concerned about. Yeah, I'm on the same page here. I think we all are. How can we begin this process sooner than later? There's nothing that it will happen part of this process when it happens. So we're moving into what happens, what is effective on July 1st, 26, right?
Right.
And so we remember, so we're getting a report October then a report January. And each of those might inform changes that go into effect on, in July 26th.
Right. So the VHART officially is officially takes effect fiscal year 27.
Yeah. Okay. It's just July 26th.
Yes, yeah. So we're amending the definition section. Community Action Agency means an agency designated pursuant to 3 VSA, Chapter 59, or the entity or entity otherwise authorized by the department pursuant to 2205 of this chapter to fulfill the duties of the Community Action Agency under this chapter. 2204, establishment. VHART is established in the department to provide services to households that are homeless or at risk of becoming homeless to the extent funds exist. The department shall select and enter into an agreement with a statewide organization that has population-specific service experience to provide or cause to be provided supportive services and shelter to those households that are experiencing or that have experienced domestic or sexual violence. All other participating households shall be served by or through a community action agency responsible for a geographically distinct region of the state. Community action agencies participating in the program shall provide or cause to be provided supportive services, extreme weather event shelter, or emergency shelter. Authorization, reauthorization review. The department shall select and enter into an agreement with the statewide organization to provide or cause to be provided supportive services and shelter to those households that are experiencing or that have experienced domestic or sexual violence. The department shall conduct regular reviews of the statewide organization to ensure compliance with this chapter. The statewide organization may be subject to corrective actions by the department if within the constraints of appropriated resources, it no longer meets the requirement of this chapter, or has failed to adequately meet the needs of households that are experiencing or that have experienced domestic or sexual violence. If the statewide organization cannot fulfill its responsibilities under this chapter, the department shall work with another entity to ensure that there is not a gap in services. The department shall authorize a community action agency to serve or cause to be served households that are homeless or at risk of becoming homeless in geographically distinct in a geographically distinct region of the state if it meets the criteria in this section. A community action agency cannot fulfill its responsibilities under this chapter. The department shall work with other community action agencies or other appropriate community entities to ensure that there is not a gap in services in a community action agency region. A community action agency providing or causing to provide services in accordance with this chapter shall have existing or planned infrastructure to support households in the region, including an established leadership team, a human resources staff, and the ability to receive grant funding and issue subgrants. The ability to meet the department's reporting requirements, including having a past history of reporting compliance. The capacity to perform the core services required pursuant to section 2206 of this chapter.
So just, I know, I think I'm stopping you in the middle. But, so this goes into effect next July.
Yes.
And then, so at some point next winter, because we're getting reports back in October and January, the gaps will be higher. So the use of funding will occur in the winter. Hire. They need to hire people. The VHART doesn't go into effect until July 26th. How does that sort out with, personnel and all that? How does that sort out with the appropriations that's in the bill for hiring people into this new program that does not go into effect until July 26th?
Question.
It is a good question.
You want to have ramp up. You could allow some of that 3 million to be used towards ramp up for the 4.5.
Yeah.
You know, allow them to start hiring for planning, whatever they need to do to be able to hit the road July 1st.
Yeah. Yeah, no, because
on the flip side is there also,
they got
there's BAA and then there's also the budget of next year, which would give them some time, not a lot, but there's some time between May and July.
yeah.
And that's probably part of the future plan, right? Or-
I know they need some resources to plan, but there's nothing in here for their planning. It's really about standing up FEMA. And it's about having it go forward on in July 26th. And how do you ramp up for that? So Amy, you were thinking on this.
Yeah, Madam Chair, Amy Schallenberger from VCAP. I believe the budget that was presented to you yesterday and also last week was based on this timeline. So the hiring of people is to be ready to take over the program as it's contemplated in this bill.
Right. So, but we don't want the hiring to begin this summer because it's not.
I think the hiring, I don't want to speak for Lily, but Director Sojourner did work with each CAP to think about when they would be bringing the positions on, and that budget reflects when we would be hiring, not July 1. Some will be hired right away and some will be hired later.
Okay. Yes.
This was a tricky question. The budget that the community action agencies presented included some more administrative positions to come on in the last quarter to help ensure that some types of services would be ready, but it did not include direct service staff being ready. And so when we had talked about on page 23, row 5, under the report that's due in October, one of the elements is a timeline for the implementation of core services for the first 6 months of fiscal year 2027 to try to, I think, address this question, because we were running in a loop of like, if we don't know what the core services are, how can we then know what kind of staff we need to have in place or what kind of other. And so I think that our hope is that this would help us answer that question so that we would know, for instance, right, do we need to look at BAA? Does the budget maybe have, and this is like hypothetical, not a suggestion, but like, for instance, does general assistance emergency housing through ESD operate in July and August, and then something else comes on in September, for instance? But I think that was the goal of that number 5 on page 23, was to try to create space for this once we had the core services identified, because otherwise it was problematic to know who they would be having to hire for July 1 if we didn't know what they would be responsible for on July 1.
Contract.
Right.
Okay. That does make that's a good cross reference with that. So that, yeah. The distribution of the funds will be dependent on the work that happens between in the reporting that comes out in October and then January. And so the money would flow from the administration to the CAP. So it's not a non-question, but I just want to make sure that it's in the bill. No, you're shaking. your head.
No, thank you.
Oh, good, thank you. That's good. All right, so we'll continue on, but just want to make sure that we've got everything sort of tightened up. And we know that when we need the money, it's going to the right place for the right services. And it's not just going out being used up before we know how it's might be used. I'm getting a nod from both Lily and Dean, so that helps. Yeah. Okay.
So to be authorized, continue on with this list, subdivision D, the community action agency, in separate capacities, and accept charitable contributions, grants, and services and volunteers, including money, clothing, furniture. Any outcome measures established in this chapter. Community connections with other providers in the region, including local housing coalitions, housing providers, providers of coordinated entry, continuums of care, faith-based organizations and providers of services to individuals or older reminders. Individuals who have disabilities, a substance use disorder, or a mental health condition. Individuals re-entering the community after incarceration. Louder, sorry, my voice is getting tired.
I know your voice being
Individuals,
used too much.
individuals transitioning from the care and custody of the Commissioner for Children and families with children. And it's the ability to provide plain language communications to households receiving services. In subdivision 3, not less than every 3 years, the department shall conduct a reauthorization review of each community action agency providing or causing to provide services pursuant to this chapter. An organization may be subject to corrective actions by the department if, within the constraint of appropriated resources, it no longer meets the requirements in subdivision 2 of this subsection, or has failed to adequately meet the needs of households in its region that are homeless or at risk of homelessness. Lack of compliance may result in the department deciding not to reauthorize a community action agency. The department may review progress of any previously required corrective actions and may review community action agency performance between reauthorization reviews. Page 12, the hardcore services. The department shall enter into an agreement with a statewide organization with population-specific experience, serving households that are experiencing or that have experienced domestic or sexual violence. The organization shall provide or cause to be provided various shelter and case management services to support households. In subsection B, each community action agency shall offer or cause to be offered in collaboration with community partners each of the following services within its region. Supportive services, including intake assessments and services for diversion from homelessness, which shall include regional intake shelters. Household needs assessment, individualized household plans to address identified needs. Housing navigation and retention services. Assistance obtaining and retaining housing, including financial assistance. Landlord-tenant outreach, education, and conflict resolution. Navigation to other services and supports is identified in the household's housing plan, including economic benefits, peer-supported services, job training and employment services, services related to disability and independent living, and referral to healthcare assistance such as treatment for mental health conditions and substance use disorder, as provided by designated and specialized service agencies and preferred providers respectively. Advocacy and progress monitoring interventions, and subdivision 2, the operation of extreme weather event shelters, which may include time-limited congregate accommodations and may be provided through agreements with municipalities or other entities, utilizing available data and considering geographic access to prioritize funding for this purpose. Subdivision 3, the operation of emergency shelters in a manner that builds upon the federally required community planning process and prioritizes households in need of services of an emergency shelter, which may include community-based shelters, temporary use of hotels and motels, lease agreements for full or partial use of an existing building. Need-specific shelter arrangements, master grant leases, the development of shelter capacity, or other arrangements or combinations of arrangements that comply with the intent of this chapter. Use of hotels and motel rooms. It is the intent of the General Assembly to decrease reliance on hotel and motel rooms for emergency housing. Annually, as shelter capacity increases in each region of the state, the use of hotel and motel rooms for emergency housing in that region shall decrease. Annually, as part of the department's budget presentations, the department shall set goals for increased housing capacity, including shelter beds, permanent supportive housing, and permanent affordable housing, in addition to proposed corresponding decreases in the use of hotel and motel rooms.
So that's where I had that question. Keep going on. I mean, when we get to the end of that paragraph.
The department shall provide data pertaining to the percentage of increased shelter capacity from the previous fiscal year in each region and how that increase impacts the corresponding hotel and motel room usage for emergency housing in each region of the state pursuant to the subsection for the purpose of informing regional Oops, I stopped sharing.
So we have the department setting the goals for, increased housing capacity based on right inputs. We set the goals. How do we,
If there's no money, should it be goal?
no, it's just, how do you enforce it? It's the thing. Set a goal. Goal's a great thing. How's it gonna happen? How do you measure? I mean, we can measure, yeah. We'll leave it there, but this is, when does this one go into effect? This is,
This is, 20 fiscal year.
we're at 27. We're next year, I mean, fiscal year beginning July 26. So there'll be some conversation about this, I would hope, as the program is established. How do we, I mean, part of it, we had Alex Farrell and talking about his work with housing. We've all talked with the HCB in the past. We know that the regional planning commissions are establishing goals for municipalities for food housing, including affordable housing. And it would be great if the goal was set, you know, link to all of that, that's a broader discussion that goes beyond what we have in this bill. And then we've got barriers out there to keep it from being built. I don't want to bring up too much more than complicated. Okay, so we'll just, anybody wanna? We okay with this one? Let's keep going. Setting the goals. Right, okay. Maybe I'm overthinking everything. Go ahead.
Yeah, just wanted to add that I do think, and I think the department would do this with the language that's in there now, but the Department for Housing and Community Development does have to track progress toward statewide or regional housing targets as part of, I believe, the Home Act of 2023 and Act 181 of 2024. And so they have a dashboard, and I think the department would coordinate with them on these efforts.
I don't think we have to tell you how to do that.
So I just, for reference, wanted to make
Yeah,
sure
no,
in case
great.
the committee was not
Thank you.
remembering or.
Yeah, no, that's exactly right. Okay,
Moving to subsection B. Okay. The hotels and motels are used to provide emergency shelter pursuant to this chapter. The hotel and motel operator shall comply with program rules and the following goals. And then we have the licensed lodging establishment rule, Vermont Fire and Safety Building Safety Code. Subsection C, annually the department shall propose hotel and motel rates as part of its budget presentation for approval to the General Assembly, by the General Assembly. A community action agency shall not pay or cause to be paid with the state monies a per room per night basis that exceeds the rate approved by the General Assembly. Subsection D, if a hotel or motel is being utilized, a community action agency shall enter into agreements for the use of blocks of hotel and motel rooms and negotiate the conditions of use for those blocks, including access for providers of case management or other supportive services. Shall prioritize the use of hotel and motel room agreements over individual per room per night of hotel and motel room use, unless it's not appropriate to a household needs, and may use strategic placements to the extent certain populations are not isolated from the wider community served through the program. We have duties of the department and the agency shall have statewide responsibility for meeting the intent of this chapter, including statewide planning, system development, proposing adequate funding, and the involvement of all the agency's departments. For the purpose of providing administrative oversight and monitoring of the program established in this chapter, the department shall maintain guidance regarding when extreme weather event shelters shall be operated, including flexibility for regional weather conditions, and Maintain a website with the locations of all extreme weather event shelters. Include as part of any review of a community action agency required pursuant to Title III, the community action agency's ability to perform the requirements of this chapter. Consult with the community action agencies and the statewide organizations serving households that are experiencing or have experienced domestic and sexual violence to develop appropriate resource allocations and methods for adjustment that take into account available data, the presence of community-based providers, and customary resource allocation methods, economic indicators, rate of homelessness, rental vacancy rates, and other variables as appropriate. And annually distribute funding to each community action agency and the statewide organization serving households that are experiencing or that have experienced domestic and sexual violence. Using the allocation formula developed pursuant to subdivision A of this subdivision B3, or if the department and community action agencies agree, disperse a joint allocation for all community action agencies, which the community action agency shall determine how to distribute amongst themselves. Provide support and technical assistance to the community action agencies or other community partners and the statewide organizations serving households that are experiencing or that have experienced domestic or sexual violence. Second, I have a
You okay?
Yeah, sorry, I want to change, I want to see how I had, I think it should be an or instead of an and. I just wanted to see how I had it written elsewhere.
Which one?
Experienced domestic
Oh,
and sexual
or-
violence, or, yeah, but I wonder if I've done that throughout now. I'll change it here. Identify, specific administrative resources that could be transitioned to community operations. Develop and maintain standards for the core services listed section 2206 of this chapter, including the operation of community-based shelters. And adopt rules pursuant to 3 VSA chapter 25 in consultation with the community action agencies and the statewide organizations serving households that are experiencing or that have experienced domestic and sexual violence as appropriate for the implementation of this chapter, including accommodations for individuals with disability. Okay. Regional planning needs assessment as part of the plan required every 3 years pursuant to 3 VSA section 3904 and the federally required planning and needs assessment for continuums of care. The community action agency shall develop a regional needs assessment and planning process in collaboration with community and state partners for use in each community action agency's region to inform future plans addressing housing and homelessness in each region of the state. The regional needs assessment and planning process plans shall include addressing progress in reducing the number of households experiencing homelessness in a region, assessing the rate households placed in permanent housing, return to homelessness and the underlying reasons. 3, identifying resources developed and utilized in the region to address homelessness and efforts to improve the equitable distribution of these resources in the region. Reporting the rate of household participation with coordinated entry processes and case management services. Identifying system gaps and the funding needed to address those gaps, including periodic inflationary adjustments, and utilizing data, including Vermont's point in time count, coordinated entry assessment results, and community conversations. Every 3 years, each community action agency shall submit plans developed pursuant to this section to the department in a format prescribed by the department. Upon receipt of the plans, the department shall consolidate the results of these reports and submit the consolidated report to the House Committee on Human Services and to the Senate Committee on Health and Welfare. For reporting requirements, on or before the last day of every 3rd month, the department shall submit a report in consultation with the community action agencies and the statewide organizations serving households experiencing domestic or sexual violence. To the House Committee on Human Services, Senate Committee on Health and Welfare, and the Joint Fiscal Committee, addressing the number of households served through the program by household size and if applicable, by eligibility category, region, service provider, and type of service. The number of household members employed on a part-time and full-time basis, and the number of household and the number, oh, we already corrected that, household members receiving supplemental security income or SSDI. Changes in capacity for shelter beds, nursing homes, and residential care homes since the previous reporting period. The number of diversions made during the previous reporting period. The number of households whose intake assessment indicated a potential need for services from each agency within the department. The number of households that have been successfully transitioned to permanent housing since the previous reporting period. The type of housing settings in which they've been placed and any supportive services they are receiving in conjunction with their housing. The number of households that may be transitioned to permanent housing in the coming months. Any state rules and local regulations and ordinances that are impeding the timely development of safe, decent, affordable housing in Vermont communities in order to identify areas in which flexibility or discretion are available and advise whether the temporary suspension of relevant state rules and local regulations or ordinances or the adoption or amendment of state rules would facilitate faster and less costly revitalization of existing housing and construction of new housing units. An inventory of all subgrants issued by the statewide organization serving households experiencing or who have experienced domestic or sexual violence and by each community action agency. Then we have the regional advisory council language, which is the same as what we've already been over. That brings us to page 21.
This is all repetitive.
That language is top of page 21 is the codified language effective fiscal year 28. And that adds top in to the purpose statement. And then we get to section 6, the hard implementation planning. So this is the 2 reports from DCF. On or before October 1, 2025, DCF in collaboration with the community action agencies and the statewide organization serving households that are experiencing or have experienced domestic or sexual violence shall submit the first of 2 written implementation plans to various policy committees and joint fiscal outlining an initial plan for the implementation of VHARD on or before July 1, 2026. Specifically, the first implementation plan shall include a process that community action agencies in coordination with the department shall use to conduct regularly occurring regional needs assessments and develop future regional plans, including consideration of municipal needs. Second, recommended performance measures to evaluate the community action agencies and the statewide organizations serving households that are experiencing or that have experienced domestic or sexual violence and carrying out their duties under this chapter, including the provision of any previously agreed upon information to enable the department to evaluate the services provided through grant funds, the effect of households receiving services, and an accounting of expended grant funds, and performance measures that may be specific to an individual region of the state or provider, recommended eligibility for each of the services offered through Title 33, Chapter 22. Guidance regarding the extreme weather event shelters shall be operated, including flexibility for regional weather conditions. A timeline for the implementation of core services listed in Title 3, 2206 for the first 6 months of fiscal year 27. Recommended intake and assessment processes to determine appropriate shelter and services for households based on program eligibility. And a recommended process to enable an unwilling community action agency to opt out of participation in the program in a manner that gives the state adequate notice. On or before January 15, 2026, DCF in collaboration with community action agencies, regional advisory councils established in 33 VSA 2204 and the statewide, and the statewide organization serving households that are experiencing or that have experienced domestic or sexual violence shall submit the second of 2 written implementation plans to the House Committee on Human Services and the Senate Committee on Health and Welfare, outlining its initial plans for the implementation of BHART on or before July 1, 2026. Specifically, the second implementation plan shall include recommendations on the following. Funding allocations among the community action agencies and other providers, including for services specific to households that are experiencing or that have experienced domestic or sexual violence. Additional state and federal funding and other resources identified for the program. Establishing an appeals process that includes a hearing before the Human Services Board and an option for an expedited appeals process. The role of 2-in-1 within the intake system, whether access to all or some services should include an expectation regarding household participation in case management services or other expectations such as night limits on the use of hotel and motels, and if so, what elements and in what circumstances participation in case management services or other expectations should be applied, whether the use of emergency shelter should include financial participation, and if so, what that participation should include, whether intake and assessment processes should include verification of residency, homelessness, and household income, how to best ensure that there is equitable access to shelter and supportive services for households experiencing homelessness, and any anticipated challenges requiring a legislative solution. Section 7 is the interim and final needs assessment and plans. This is
So my suggestion right here is to take a 5-minute break. Okay, let's do that. And then we'll come back to this and we'll be on our way to going through the rest of the bill. So, it does.